Plantar flexors include peroneus longus, peroneus brevis, tibialis posterior, flexor digitorum longus, flexor hallucis longus, gastrocnemius solus, and plantaris. Those perform plantar flexion, which is like going up on the toe or pointing the toes. If someone has weak plantar flexors, there's going to be an abnormal gait. So, for example, during mid stance or terminal stance, mid stance being crossing over the stance leg, terminal being the heel rise to the opposite heel strike. There's going to be excessive dorsiflexion, and there's going to, the plantar flexors are not going to be able to control that advancing tibia. There could also be some toe clawing throughout the entire gait, and then there's not going to be a heel off at the terminal stance and at the pre-swing. And that's just because those plantar flexors are not able to do that, not able to rise there. So sometimes they can also do a heel walking, which is keeping those dorsiflexors active and the foot is kept in neutral. So they're going to take higher steps. The hip and the knee are going to be compensating for what the plantar flexors are not doing. So they're going to take a step more up here, and then when they come down, instead of landing on their heel like a normal gait, they're going to land toes first. So they're not rolling, they're going toe first. And this is called a steppage gait. So I'm going to demonstrate what this looks like. My right leg is going to be my affected leg. Again, they're not able to come up on the toes, so the gait would look something like this. Also, on the uninfected side, there could be a shorter step length. So the reason for this would be like an injury to the ankle, so like a fracture or a sprain, and then muscle atrophy. So if you had a patient who had been bedbound, maybe from a surgery, and then they were not working these muscles while they were bedbound, well, when they get up, those muscles have atrophied. So what you can do is some muscle strengthening, re-education, and you can do that with electrical stimulation. They would work with the machine. You could do biofeedback, or even get a TheraBand, have them wrap around that toe, and then just work with it, and there's different resistances for that. Obviously, based on their diagnosis and their pre-existing conditions, that will help you decide for the plan of care whether they should do e-stim or biofeedback or just whatever.